I'll take this in reverse order. If there's a political position, it's probably something akin to cultural Marxism. Marxism, as we know it, is economic distribution of wealth, right? And this is a cultural redistribution of whatever perceptions people have of your resources, we'll call them. I don't want to say money, but it's your power, your privilege, your whatever you've achieved in life. They want to tear that down and somehow disseminate it, I don't know, like through osmosis or something. So if there's a political position, it's that. But I don't think there is one because by definition, postmodernism can't take a stand on anything. So there is no thing that they're trying to achieve, because if you achieve it, then you've achieved something, and therefore they could claim victory, and then it would be over. But it won't be over because there's always something else to be done, to be deconstructed, some system to be taken down or torn apart, or some faceless object at which we throw eggs, right? So I don't think it's political at all. I think it's ideological, and I think it's culturally narcissistic, where we've created a class of people who happen to have largely graduate degrees, sometimes not, but they're out for power and control over others because they can't control themselves. And so as I'm working back through this, what happened with the legends of the field, the Adlers, the Freuds, the Jungs, the Freud's a little out there, so maybe not him, but the people who have well thought these things, Joseph Campbell, David Hawkins, he's a little weird too, but the concepts are good, right? There's a depth of human psyche, and psyche, for the listening audience who don't know, it's Greek. Psyche was said to be the goddess of the human soul. So psyche, soul, mind, we use them interchangeably, although we could have a debate about what is what. The idea is that humans are deeper than their outward behaviors. There's more to you than you realize. And I think the reason we don't do that work anymore is because it's hard, and we're just taught to be lazy and cherry pick intervention strategies and throw them at people. And that passes for good work. So there's that. We're in a culture of instant gratification driven by everything. Probably started with the microwave oven, I don't know, back in the 50s or something. And then it went to the VCR where you could like pause, record things and skip commercials. And now it's accelerated to, drone delivery of your groceries or whatever it is. And so we have no patience. We don't have any distress tolerance. And therefore, we're not going to be patient and tolerate distress in the therapy office either. It's just much, much easier to deal with what's observable. And by the way, it's funded. If I can tell you that you now smoke fewer cigarettes per day over 6 months versus the previous 6 months, and I've captured that in a year, and then I followed you for 6 more months for a total of 18, I can claim victory over your cigarette habit. Now you pay me because I've provided evidence, and here's where we get the evidence-based practices, right? So there's a lot of incentives built into this new structure. There's the financial motivation to produce results. There's the instant gratification of our culture. There's the lack of willingness to go deep into one's own psyche. But the reason behind not wanting to go deep and do the hard work is because it would require me knowing who I am relative to the person across from me such that I could guide them there. And if I've been told over years of graduate school and then years of internship and then years of professional counseling, we'll say I'm like 5 or 6 years into the field now, and all I've heard is nothing is real. Don't be a jerk and tell people what's up. Don't try to force your truth into somebody else's life. Well, I'm not going to be willing to go explore somebody else's psyche to the depths that are required to uproot the problem. It's way more easy just to treat the symptoms. And for anybody who's curious, an unorthodox opinion is that I happen to think that everything in the DSM is a symptom. I think the problems are things that don't have codes attached to them that give rise to the symptoms. And so that would be things like self-efficacy, trauma history, not knowing where one is going in life, lack of emotional understanding or tolerance or education, things that don't have codes, right? And if I have those things, there's only a handful of them. There's not too many problems with a human. There's lots of symptoms, lots of ways it manifests. So if I'm not confident in myself, I could bounce into narcissistic personality disorder, or I could drink too much, or I could do methamphetamine to, amp myself up to make myself feel better, like I can accomplish a bunch of stuff, or I could take, psychotropic medication to dull the whatever's going on, or I can slip into psychosis because I can create my alternate reality. If I don't believe that I'm confident enough to handle my own reality, I can just create one. I can slip into depression. Like there's lots of ways that my lack of self-efficacy can manifest in a symptom that's codable that I could send off to insurance. It works really well for the BTs. If I do DBT and fix your borderline personality disorder, something that's workable so you're functional in society, I get to self-congratulate, right? but did I tackle the why you even had borderline in the first place? Did I ever talk about your trauma history? So, and this is where affirming care goes off the rails. And, it starts with gender affirming because that's on everybody's minds. Somebody comes in and they're gender dysphoric, right? They don't know if they're a boy or a girl or a cat or a dog. And we're supposed to, as commanded by the AAMFT and its 26 pages of guidance, just agree with them. Like, I'm supposed to agree with your dysfunction? That doesn't even make sense. Like, what am I agreeing with? You came in ailing, allegedly hiring to seek my help. In what other profession would the professional ever go, yep, you know what? You don't need my help. Well, why are you in my office then? Like, would an attorney do that? No, a doctor wouldn't do that. A dentist wouldn't do. Like, imagine rolling into the dentist's office being like, hey, doc, I need you to pull this tooth here. Doc's like, actually, I need to pull the other tooth. Like, no. You're not affirming me. That would never happen. But we're under that constant threat, and it's all the time. If we don't affirm somebody, we've caused harm, nay, abuse, right? That's the problem where we find ourselves. So I think it's a confluence of laziness and lethargy, lack of intellectual curiosity, lack of knowing who we are such that we can guide somebody else through their stuff, lack of distress tolerance, desire for instant gratification, and money.